Question: does your heart ever start to pound, race, or feel like it's erratic? These sensations are called palpitations. Heart palpitations are a rare occurrence for most people, but for some, these heart sensations can occur multiple times every day, sometimes so strong and irregular that they can make you feel like you're going crazy or even about to pass out. During this episode of Dr. Dave's 411, we are going to briefly review my approach to palpitations, and I promise we are not going to miss a beat. Miss a beat, palpitation, never mind. Heart palpitations are the sensation of a fluttering, rapid, or unusually strong heartbeat. Heart palpitations can be triggered by many different environmental or lifestyle factors, such as stress, anxiety, caffeine, dehydration, medications, physical activity, or over-the-counter substances like cold medications and weight loss pills. Palpitations can also be caused by underlying medical conditions such as thyroid abnormalities, electrolyte abnormalities, potassium and magnesium, fever, anemia, and many more. While most palpitations are harmless, they can sometimes indicate a more serious heart condition such as arrhythmias, valvular heart disease, coronary artery disease or blockages, or cardiomyopathies, weak hearts. Okay, so if you have palpitations, what next? First, pay attention to a few things when you're having the palpitations so you can relay them to your healthcare provider. Number one, check your pulse. You can put your two fingers, your index and middle finger, just below the thumb side of your wrist and feel your radial artery. Is it fast or slow? Regular like a clock or irregular? Number two, what are you doing when the palpitations start? Are they related to a particular activity, mental stress, anxiety, or food intake? Number three, do they come on and leave rapidly, or are they more gradual? Number four, do you have any symptoms during your palpitations? Dizziness, chest pain, or shortness of breath? So, what should you do if you experience palpitations? I always recommend seeing your healthcare provider. Even though most palpitations are not serious, I always feel like it's a good idea to get checked. Typically, your healthcare provider or cardiologist will take a good history and physical, perform an EKG, check your blood work, and place a Holter monitor, which is a device a patient will wear for typically 24 hours, so we can see exactly what is going on with the heart during these episodes. The Holter monitor can be incredibly important in pinpointing exactly what is causing your sensation of palpitations. If your palpitations are sporadic and don't happen when you're wearing your Holter monitor, then there is an event recorder that can monitor the heart for days or weeks. Depending on your symptoms, age, and medical history, sometimes an ultrasound of the heart called an echocardiogram and even a stress test may be necessary. Until your healthcare provider or cardiologist figures out what is causing your palpitations, there are a few things you can do to help. Number one, stay hydrated. Number two, try to avoid excessive stress. Number three, cut down on caffeine and alcohol. Number four, get enough sleep. Number five, make sure you eat a well-balanced meal and in regular intervals. And finally, avoid over-the-counter remedies, supplements, or herbal medications. If you're having palpitations, there are a couple of maneuvers you can do to try to slow your heart rate down if you feel it's racing. Number one, try deep, relaxing breathing. If the palpitations are really troublesome, especially if they are rapid, you can try what's called a Valsalva maneuver, where you pinch your nose, close your mouth, and try to breathe through your nose. Or another maneuver, Valsalva maneuver, is you can bear down like you're having a bowel movement. These maneuvers can help slow the heart rate down if you feel it's racing. Please remember, most palpitations are not serious, but rather what is being called a heart hiccup. But make sure you get checked. Okay, time for a quick Dr. Dave's 411 joke before I go. Patient says, "Doctor, I get heartburn every time I eat birthday cake." Doctor, next time, take off the candles. Okay guys, I'll stick to cardiology. Until next time, this is Dr. Dave.